Welcome again to Better Prevention, and thank you for being one of us. Today we are to discuss how to prevent premature deaths caused by diabetes mellitus. Let's start by understanding the risk factors or the causes and the complications of diabetes. The risk factors include number 1, physical inactivity. When we are lazy in doing physical exercises, we increase the chances of contracting diabetes mellitus. Exercises assist in improving the health of the body organs, including the heart, the kidneys, the blood vessels, among other parts of the body, at the same time improving the overall immune system of the body. They assist in using up glucose as energy and makes our cells more sensitive to insulin. The exercises can be done in 30 to 60 minutes depending on your health and your age. The exercises include walking, cycling, swimming, jogging, among others. Number 2, overweight or obesity. The more fatty tissues we have, the more resistant our cells become to insulin. We should maintain a healthy body weight by eating healthy and doing physical activities. Number 3, high blood pressure or hypertension. Having unmanaged high blood pressure is a risk factor to diabetes mellitus, and therefore we should do our best in managing our high blood pressure. Number 4, hyperglycemia. This is a condition where we have increased blood glucose in the blood, and this increases the risk of contracting diabetes. Number 5, hyperlipidemia is a condition where we have increased fats or lipids levels in the blood. This increases the chances of contracting diabetes mellitus. Number 6, family history. If in our family there are blood relatives suffering from diabetes, the risk of contracting diabetes is very high. Number 7, age. The risk of contracting diabetes increases as we age. This may be due to reduced physical exercises or poor health, among other risk factors. Number 8, abnormal cholesterol and triglyceride levels in the blood. When we have low levels of high density lipoprotein, that is HDL or good cholesterol, the risk of diabetes mellitus increases. Those who have high levels of triglycerides increases the risk of diabetes mellitus, and therefore we should take control of cholesterol and triglyceride levels in our bodies. Let us discuss the complications brought about diabetes mellitus, how to prevent, control, and manage them. Number 1, cardiovascular diseases. Diabetes is a risk factor to many cardiovascular diseases, including coronary artery diseases, stroke, heart attack, atherosclerosis, or narrowing of the arteries, among other cardiovascular diseases. Number 2, nephropathy or kidney damage. Diabetes can damage the tiny blood vessel clusters or glomeruli that help in filtering waste from the blood. Severe damage of the glomerule can lead to kidney diseases. Number 3, neuropathy or nerve damage. The capillaries are the tiny blood vessels that nourish the nerves up to the legs. Excess sugars in the blood can damage them, leading to numbness, tingling, or pain that begins at the tips of the toes, fingers, and gradually spread upwards. Damage to the digestion nerves can cause problems like vomiting, diarrhea, nausea, constipation, erectile dysfunction, among others. Number 4, retinopathy or eye damage. Due to diabetes, the blood vessels of the retina can be damaged, leading to vision complications like blindness, among other eye conditions. Number 5, foot damage. Diabetes may lead to poor flow of blood to the feet, or it can cause nerve damage, increasing the risk of foot complications. If left untreated, blisters and cuts develop serious infections which may finally require toe or leg amputation. Now let's discuss the ways of preventing and managing the complications brought about diabetes mellitus. Number 1, eating a healthy diet. We should eat a balanced diet rich in vegetables, fruits, proteins, and reduced carbohydrates. The vegetables and fruits should be eaten in different forms, including juice form, salad form, and when cooked. When we eat the vegetables and fruits in these three forms, we enable the body to get all the antioxidants which are required for an improved immune system. We also improve the health of the blood vessels and other body organs. When we eat proteins, we should have more plant-based proteins, which include beans, soy, nuts, among others. Number 2, do regular physical activities. The exercises may include walking, cycling, swimming, among other physical exercises. They help in strengthening the heart, improving the pumping and the circulation of blood, improving the health of the blood vessels and other body organs. Number 3, quit smoking. Smoking increases the risk of diabetes mellitus, and due to this, the risk of heart diseases, stroke, eye conditions, nerve damage, among other diabetic complications increase, and therefore we should quit smoking. Smoking can also cause some cancers like lung cancer. Number 4, manage your high blood pressure. Hypertension is a risk factor to diabetes, and it should be managed well by doing regular physical activities, which we have said may include walking, swimming, cycling, digging, among others. Eating a healthy diet, among other management ways of hypertension. Number 5, schedule regular eye exams. Our eyes should be checked 2 or 3 times a year to avoid blindness and other eye conditions which are brought about diabetes mellitus. Number 6, avoid feet injury. We should take care of our body parts, including the feet, to avoid injuries which can lead to serious infections. Diabetes can lead to tingling, loss of sensation in the feet, among other feet conditions. The following are some of the health ways of taking care of our feet. A. Our feet should be washed well and, if possible, in lukewarm water. Soaking the feet should be avoided or minimized. B. The feet should be dried gently, including in the toes. C. Check the feet regularly to monitor soles, blisters, and any swelling. D. Minimize barefooting. Barefooting should be minimized both indoors and outdoors to minimize injuries. Talk to your doctor or your specialist to know the best shoes for yourself. Number 7, regulate alcohol intake. If you must drink alcohol, regulate the amount, since it is thought to be a risk factor to many non-communicable diseases, including diabetes mellitus, among others. Number 8, manage your stress. Unmanaged stress can lead to more diabetes complications. Number 9, have enough sleep. Having enough sleep helps in improving the functioning of the body organs. Please remember to subscribe, share, and like, and don't miss our next health lesson.